You're listening to an Airwave Media Podcast.
Welcome to Unbiased Science,
where we bring scientific method to the madness.
We're your hosts, Dr. Jess
and Dr. Sarah Scheinman.
And this week, we are talking about the F word, fluoride. Spoiler alert, yes, fluoride, and also...
Sorry, I didn't know that's how you were starting. I'm so excited.
Having a little fun today. Fluoride, and then also the quote-unquote... alternative to fluoride that a lot of people are talking about, hydroxyapatite, because 1,000 of you have sent us messages about this. There's been some news around fluoride, some policy changes or announcements. We'll get into that in a second. Before we introduce today's amazing guest, a very quick public health update, which is to say that there is some concerning data from other countries. I think it's primarily the UK, Canada. I'm for blanking, of course, right this second on the specific countries, but basically showing that this year's flu season is likely to be a doozy, potentially the worst that we've seen in a decade. Mm-hmm. This is obviously not great news, but luckily we have flu vaccines, which, although not perfect and not always a great match for the circulating strains, they will help lessen the severity of illness, shorten the duration of illness. I got my shot. My kids got the shot. Ethan, my hubby, ER doc, got the shot. Same as COVID, same time.
I got the shot, and I'm deathly afraid of needles, so anyone can do it.
That's right. I forgot that you have needle phobia.
Oh yeah. I have to have someone come and hold my hand when I get vaccinated. It's
you know that there
ordeal.
Is a needle-free option.
Really?
I don't know if you know, there is. It's called Flu Mist.
Oh my
It is
God.
eligible. I just blew Sarah's mind.
What?
It's a narrow. Yeah, there's certain groups that can't get it because I believe it is a live attenuated vaccine. So if you're immunocompromised, there's certain groups that can't get it. But you might be eligible. So something to look into if that is a big concern for you.
For next season, for sure.
Yes. Anyway, without further ado, Sarah, can you please introduce today's amazing guest?
Absolutely. You guys, we are joined today by Dr. Ashley Lerman, who is the visionary pediatric dentist mom behind a company called First Grin. Known across the digital world as @Mommy Pediatric Dentist, her unique blend of professional pediatric dentistry and real-world parenting insights form the cornerstone of First Grin's mission. Her dedication to transforming the global narrative around cavities, the #1 chronic disease affecting children, underpins her commitment to providing parents and caregivers with the essential knowledge and tools to build a strong oral health foundation for their young ones from the earliest stages. Dr. Lerman, thank you so much for joining us. I can't think of anyone better to come and discuss fluoride with us.
Thank you so much for having me. Love calling it the F word. It's my second favorite F word, to be honest.
Love it.
But such good timing just because of all the news around Halloween and, fluoride and the concerns. I'm getting a lot of emails, DMs about it. So excited to dig into it.
Just real quick, Ashley, what is in the background? Is that bourbon? What is that in the background of or is that tea?
I think it's supposed to be some sort of tea, like mystical setting in my digital background.
Oh.
Great catch, because I've never noticed that. And I don't think anyone's questioned it. Maybe because they thought it was bourbon.
Oh my gosh.
You
yes. Or rum, or I don't know. Anyway, you can see where my mind's at right now. All right, before we get into the F word, Ashley, we start off every episode with the same question, which is, what is something that you've seen in the news, in the health science space that has caught your attention, and why should people care about it?
So honestly, you kind of touched on it earlier, but just about how brutal this flu season has been. I have a 2.5-year-old and a 1-year-old. So lining this up for my kids, making sure our whole family is on top of it, just because they're around so many other kids. We're traveling a lot. We have a daycare situation. And if we can get ahead of that, 100% want to, just because we know how severe those consequences can be, and just making sure other families are on board with the safety, the efficacy, and sometimes they may not align with the flu specifically that strain for that year. But I'm excited that we have the opportunity to get it and just amplifying that message for families too.
Love that. It is such a pet peeve of mine when I hear people say, oh, it's just the flu. Have you had the flu? Have you had the flu?
Yeah, have you had the flu recently? It sucks.
Oh my gosh. Oh my goodness. And then
you're down for the count.
Yeah. And then you have, young kids are at high risk, elderly. I mean, it's a hot mess. Even for those of us who are otherwise healthy, it could be really, really dangerous. So yeah, I'm not messing around, and I'm pretty freaked out about this flu season, not going to lie. All right, let me set the stage here. So some stuff, Ashley, as you said, has gone down. I'm just going to read some stuff that has been in the news real quick. So Health Secretary RFK Jr. has come out and called fluoride, quote, neurotoxic and carcinogenic. He has publicly called for states to ban fluoride in drinking water. In March of this year, Utah actually became the first state to do so. Then I think it was on Halloween this year, or the day before or after, but I think it was Halloween. The FDA issued new recommendations about fluoride supplements, and they sent warning notices to 4 companies that sell them. The agency urged doctors and dentists to refrain from prescribing fluoride tablets and drops to children under 3 years and to older children who are not at high risk for tooth decay. Just to be clear, this was not an outright ban, but they have placed pressure on both healthcare professionals as well as these companies. So, Ashley, what do you think about this? Do you think that this was the right move?
I mean, I think the answer is a blaring no. I don't think this is a right move. We all know from data, public health data, dental data, medical data, how well systemic fluoride is for an additional layer of protection for teeth, specifically for people who don't have access to care issues. We know how safe and effective it is at the doses we prescribe it. But even taking a step back from that, it really should be up to the doctor, the dentist, to decide on an individual level what that risk is for the individual. Some people may need it, some people may not. But to throw this blanket statement that all kids under 3 shouldn't have it can be extremely detrimental, and it's going to have resounding effects in the future for increased cavity risk for vulnerable kids. And that's a brutal, brutal realization to have.
Yeah. And my understanding is that doctors and dentists, it's not like you were just tossing these out at everyone. You were already applying your clinical judgment, and as you just said, sort of determining who is high risk, who should be taking these fluoride tablets. So this isn't something that's being pushed, So anyway, it's very frustrating. And what it's done is it's created a lot of noise around fluoride right now. So you said it, we are receiving, I'm not exaggerating, it must have been thousands of messages about fluoride. So it sounds like you're being inundated with a lot of those messages as well.
Yeah, I mean, you hit the nail on the head. And one of the biggest things with fluoride is it's not binary. Like if you take fluoride, you can still get cavities and you could still have good protection.
Right.
It depends on an individual, and there are so many other risk factors. And fluoride's distributed in 2 ways, through supplements or water, or through toothpaste or topically, and they work very differently. But the problem about news like this is that a layperson or someone scrolling through and seeing a media news title, they can't distinguish the two. So they start to demonize topical fluoride, like in toothpaste, and we know that effect of fluoride is really, really effective. So to take it all away completely, it's putting people at a much, much higher risk for cavities than I think we realize.
Ashley, can we just step back for a second and just for the folks who are unfamiliar, because like you said, there's so much noise around it. What is fluoride exactly? What is it doing to your teeth? Why is it so important?
So when we talk about systemic fluoride or fluoride in toothpaste, again, I'll go back and say they work in different ways. So it's a mineral that's found naturally, and when exposed to teeth, it helps replace ions in the tooth to make it stronger, more resistant to acid. So when we're eating and drinking through the day, our mouth turns acidic, and fluoride helps combat that and makes our mouth stronger against that. When it comes to toothpaste, it's just a matter of frequency that our teeth are exposed to it. So the more frequently we apply fluoride to it, the more frequently we're combating that acid as well.
Okay, so at the heart of a lot of the concern is this idea that fluoride leads to a reduction in IQ, right? And so there have been some studies, there have been some very widely disseminated meta-analyses and reviews that have led people to draw this conclusion. But there are so many caveats that we need to talk about for a second. So first of all, you said that fluoride is a naturally occurring mineral, and there are some places where fluoride just naturally occurs at higher levels than other areas, right? And so in these studies, a lot of times they're looking at places where fluoride is it naturally occurs at higher levels than what than when we're talking about fluoridated water, right? Community water supply. So why am I blanking on the units? But it's like naturally occurring in these studies. They were looking at 1.5. Is it? Do you know
ppm.
what the there you go?
Yes.
Parts per million, right? So 1.5, whereas the community water supply is regulated at 0.7. Right? So we're talking about less than half what was in these studies. The other thing is that when we talk about IQ, I mean, first of all, there are some issues with the way we measure IQ. But even in the studies that use some of the common tools that we use to assess IQ, we're talking really small differences in IQ points that could just be a blip or, statistical noise and nothing that would be clinically significant. Right, Ashley? What am I missing? Anything else you want to highlight?
No, you hit the nail on the head. And I think we're referring to the same study. People were looking at areas where it was more than double than what we're exposed to. When you take that across any medication, exposure to anything that we're taking systemically, you're bound to find some sort of side effects. So we can't take that and apply it to our everyday exposure. That is, again, like you said, less than half of that. And again, the headlines were really misleading. The data was cherry-picked and also misleading, and so much fear and noise around it. And fluoride's one of the greatest public health interventions because we know how efficacious it is. So I'm glad that we're on the same page of that and clearing up the data around it as well.
And also just from a brain perspective, what's important to note too is that poor oral health is linked to very detrimental cognitive outcomes as well. So it's important to note that you need to really consider things from all perspectives here. If you eliminate fluoride, then you're going to see an increase in cavities, and an increase in cavities leads to poorer oral health overall, which increases your risk for a variety of different neurological issues.
That's exactly right.
Ashley, I have a question. A question for you is, do you see, because you practice clinically, do you see differences in the mouths of children who do and don't either, use fluoridated toothpaste or, all the things, use fluoridated water? Do you see that difference clinically?
Absolutely. I wouldn't say it's night and day, but it's part of the bigger picture. When I was working clinically in practice around a very, very rural area, some people only had access to well water. And when they'd come in and say that, there were some mouths that you look and be like, oh, okay, this makes sense. And then it's complemented with access to care, access to nutritious foods, access to clean water rather than going for sodas, juices, all of these things playing into it because it is a very socioeconomic driven disease. But water absolutely plays a very, very fundamental role in that. And that's just a low level of access to care that people will bring.
Let's talk about some of the data we have. So there have been some really incredible natural experiments where we've seen certain areas stopped fluoridating their water as compared to those that still had fluoridated water. And we compared outcomes in those places. So let me just read some statistics here. So following cessation in Calgary, Canada, multiple analyses showed worsening caries outcomes compared with a fluoridated comparison city, Edmonton. So the average number of cavity-affected baby tooth surfaces in 7-year-olds rose by about 146% in Calgary after fluoridation ended, compared to roughly a 50% increase over the same period in nearby Edmonton. Let's see, other stats. Also, when Juneau, Alaska stopped fluoridating its water in 2007, cavity-related treatments in children rose sharply. Within 5 years, dental treatment costs for Medicaid-insured children were up by as much as 111%, adding about $300 per child in annual expenses. Also, sorry, I'm just going to bear, this is like I get on my soapbox here. This is another example of public health and prevention being a victim of its own success. I think,
Absolutely.
right? Like we forget before
Absolutely.
we had this incredible understanding of what fluoride does as a preventative tool. People we're not just talking, oh, you have a little cavity, so what? It could become a huge issue, could lead to severe infection, sepsis, death. I forget, at one point we did a post at Unbiased where it was like oral health issues, dental health issues it was like top 5 leading causes of death. I forget what year it was, and I hate to throw that out without data, but I feel like we downplay how really serious these dental issues could be.
Yeah, I think you're exactly right. And especially when it comes to fluoride supplementation, we're specifically talking about kids, which leads to people being like, oh, baby teeth don't matter. They just fall out. It doesn't matter. We start fresh with adult teeth. We have so much good data showing that the health of the baby teeth is correlated with the health of the adult teeth. And we really have to set that stage and foundation early. And people seem to overlook this phase in childhood where we have a mix of baby and adult teeth.
Right.
We don't want to have decayed baby teeth next to adult teeth because that can pass. And just taking that seriously and taking those preventive measures seriously because they absolutely work. And it's, again, the victimhood of its own success as well.
Right.
So is it maybe time to start talking about hydroxyapatite or apatites? How do we say it? Hydroxyapatite? Apatite?
Not that. That's not it. I love you.
I'm always
it's usually
reading it. I
me
never
botching
say it.
pronunciation. I know. I love you.
How do you say it, Ashley?
Hydroxyapatite, though
It is hydroxyapatite?
there may be people who pronounce it that way. I think you can nail it and make a trend, to be honest.
Potato,
I like it. I'm
potato.
on board for it. Yes.
Yeah.
Exactly.
Yeah, Jazz, you can say it in a fancy way.
Oh, yes. So Ashley,
Anyway.
what is it? And is it a good alternative? What's the data on it? What say you?
So hydroxyapatite, it's a naturally occurring mineral. Our teeth are made of it. So people are really into this idea that it's biomimetic. It's like a healthier alternative than fluoride. They have like an amazing marketing campaign behind hydroxyapatite.
Oh, yeah.
There are a lot of toothpaste companies that take this and run with it, especially when fluoride is getting demonized in the news. It just helps bolster sales, those types of things.
It's got really good PR.
It has great PR. Like, find me the agent who's working for hydroxyapatite. I need to know.
Right. We should all hire them.
The thing with, yes, there are a couple of issues with hydroxyapatite. The first is that we really don't have good long-term data on it.
Mm-hmm.
So to compare that against fluoride, which we have robust data that it's helpful in preventing cavities in 2 ways, both topically and systemically, we know that hydroxyapatite isn't on par with it at all. The way that hydroxyapatite works, it acts as a tubule occluder. So it basically plugs holes in the hydroxyapatite chain on the teeth, and it can help in sensitivity, but does nothing for remineralization.
Right.
Oh.
And when it comes to the mouth, we're constantly talking about remineralizing and fighting the acid in our mouth, because that's how cavities form, from the acid. So though hydroxyapatite may be a good complement, may be great for sensitivity, for cavity prevention, we don't know enough. We also don't know long-term the effects of, how it's eliminated from the body, et cetera, et cetera. Not to scare, again, the data, we just don't know yet. I think we'll get better in the future. So I would be wary about what these companies are trying to sell you, and also know that fluoride is extensively backed by public health.
Right.
It's even for young children, as early as 6 months. As soon as that first tooth comes in, you want to introduce fluoride toothpaste. And if you don't have access to naturally occurring fluoride, you may be prescribed fluoride supplementation too.
And do we have any side-by-side data comparing the effects of fluoride versus hydroxyapatite for preventing cavities?
Yeah, so there was one study that people often refer to, and it was comparing hydroxyapatite to basically half-strength fluoride, which normal strength, quote unquote, is 1,000 ppm. So they compared it to 500 ppm. In that study, they found that hydroxyapatite was as effective as is 500 ppm. Again, if you break down the study, it had some holes in it. So again, I think people use that to drive forward this idea that it's a great replacement, which it's not. It may be it has promising data, promising qualities. It's just not on par with how fluoride works in cavity prevention yet.
Interesting. Also, maybe I'm mistaken, but I thought that hydroxyapatite is more expensive than fluoride, which is another consideration. There is a huge, as we've sort of alluded to here and said outright, there's a huge health equity angle to this whole discussion, right? That we really have to talk about, because one thing that I've heard, and sorry, I'm all over the place here, but I often hear, oh, well, we could just, go to the dentist and get your kid their cleaning once or twice a year or whatever it is, or, brush with fluoride toothpaste, you'll be fine. We don't need fluoridated water, for example. So now I'm switching back to the community water supply, right? But that assumes that people have access to dental care. I mean, a lot of people don't. And a lot of people don't regularly brush their teeth with toothpaste or brush their teeth at all. Or, these are really important considerations. And so that's why, from a public health perspective at the population level, really, and that's, the hat that I often wear, it's like the community water supply is such an important safety net for those children and for those adults, just for all of us who don't, who don't have access to dental care. So I feel like we had to say that explicitly, because that's missing from a lot of these conversations.
Definitely. And it plays a huge role in outcomes as well. Like, there's a massive, massive access to care issue. There aren't enough dentists in the country. There aren't enough dentists accepting Medicaid in the country. So it just really gets siloed into an extremely narrow window where people can find care. And the nearest dentist may be 2 hours away. Right. And if you have a family of, let's say, 4 kids, like, when are you finding the time to drive 2 hours? There are a lot of layers to it that public fluoridation in the water system helps overcome and helps at least try to even the playing field a little bit. And that's where the health equity comes into it. So I think, again, you hit the nail on the head in terms of that.
Are people suggesting that we supplement water with hydroxyapatite instead of fluoride? Is that something that people are suggesting? Or is that just like for supplementing toothpaste and for use in dentistry?
So not in the water yet, haven't heard that yet, but as a toothpaste alternative. Okay. So a lot of these toothpaste companies will say fluoride-free, hydroxyapatite, natural occurring mineral, those kinds of things. So again, just really preying on that fear of, oh, if this is free of this ingredient, that ingredient must be bad. We see it with the dye conversations as well. It's really, really, again, preying on parental fear.
I'm sorry. I hope everyone is watching on YouTube right now, because Jess's face during all of this is just priceless.
My nostrils are flaring because it is such a marketing tool, and it is killing me. It really, we see it with seed oils, with food coloring, with all these things. And you're right, Ashley. When you say something, when you boast about it being free of fluoride, free of seed oils, my goodness, it implies that those things are bad. Really quickly, if I may, I just want to go back. I feel like I was zoning out and maybe wasn't bringing my A game when we were talking about that big report that everyone's citing. It was the NTP report, the National Toxicology Report. There was also a Cochrane review, and these are getting picked up as, these studies, these reviews found that fluoride does, impact IQ in children. When you take a look at those studies that were included in this review, there are so many issues. The majority of the studies are rated high for bias. They don't control for important variables. They're in countries with extremely high levels of naturally occurring fluoride. There's a million things. They also completely fail to account for the benefits of fluoride. So it was a very one-sided, analysis. But there were so many reasons that have given those of us who really took a close look at the data pause. Whereas here, I'm looking at the data. My children, you better believe they're having their fluoridated water. They have their fluoridated, fluoride toothpaste. They get their fluoride varnish every time we go for cleanings, right? Because the data are not compelling. And we have the American Dental Association and all the other major dental associations have really spoken out against the NTP report and said, please, please, please don't mess with fluoride. We need it in our water. Kids need to be, we need it in our toothpaste. So yeah, the consensus is there as well.
Yeah, and I like that you point that out too, because a lot of people will point to like Western Europe where fluoride just handled differently, whether it's in salt, etc. But they have a built-in system where, dentists will come into schools and they'll do fluoride trays for the children. Like we don't have a blanket covering our country like that. We just have a completely different system. So it's easy to, again, cherry pick what works somewhere and not here. But we have to look at the broader picture.
Yep. And just to your point, just a quick stat here, more than 70 million Europeans consume fluoridated table salt.
Oh.
Millions more participate in fluoridated milk programs, particularly in Eastern Europe.
Wow.
In addition, as you said, Ashley, many European nations have more extensive universal dental care systems with preventative fluoride treatments. In Asia, there's a very big school-based program where people will come in and apply things like fluoride varnish to children's teeth. And so it really, it's a bee in my bonnet when I hear people say, well, they don't fluoridate water in Europe or these other countries. It's like, because they're doing all these other things.
Yes, exactly. That's exactly right.
Oh my goodness. What else? Or do you hear any other big myths or concerns, Ashley, when it comes to fluoride?
Honestly, the biggest thing, if I had to boil it down, is just not understanding the difference between fluoride and toothpaste or topical treatments versus supplements, chews, or drops. And I think if people had that fundamental understanding, they wouldn't demonize it in toothpaste so much, for example, and understand that it is one of the most effective and safe ways to prevent cavities for every single person in the home who has teeth. So that's something I want to hit home because, again, that's my wheelhouse. I get messaged about it all the time. And again, there's a time and place for a systemic fluoride. It's very, very important, risk-based, and a doctor should be delegating that rather than, a national requirement to scare people out of being able to do that.
One more thing I want to say, all the people who come out, against fluoride for its, quote unquote link with reduction in IQ. Can we talk about what happens when children have poor oral health and they have, severe cavities or whatever? They're more likely to experience, they're missing school. They're more likely to experience delayed growth, difficulty eating, disrupted sleep, all of which can impair development. They're more likely to miss school, show poor academic performance compared to peers without dental disease. And then also, what about systemic infections, right? I mean, talking even severe cases, acutely could lead to things like ER visits, hospitalization, things that would require kids having to go under, general anesthesia, for example. But hasn't poor oral health been linked with other systemic health issues, Ashley?
Yeah, absolutely. So I also want to add psychosocial health is correlated with poor oral health as well, to add to the extensive list that you mentioned as well, especially for young kids, but adults as well. But in terms of systemic health overall, we know there's a strong correlation between cardiovascular health and oral health, correlation between diabetes and oral health. A lot of them boil down to inflammation being the mechanism behind it. So going in for those preventive routine care visits is so important to stay ahead of the ball because it really is tied to these downstream consequences. And I think Sarah mentioned it as well, just neurological effects as well. There can be ways that a dental infection leads to a brain infection and
increased risk of stroke as well.
That's a terrifying thought. Yes, increased risk of stroke. That's right. And again, boiling it down to that mechanism of inflammation. But if we can get ahead of that, why not?
Now, also, to be clear, we're not telling people to run out and go chug fluoride supplements, right? As with all things, the dose makes the poison. And yes. At high levels.
Don't chug fluoride.
No, please don't. Yeah, you heard it here first. No, because
Thank you, Dr. Steyer.
There you go. Signing off now. No, but at high levels, yes, it's a what is it, neurotoxicant or right, or neurotoxicant. I forget what the actual difference is. Someone is listening, and
we're doing great with pronunciation today here on Unbiased.
We're doing
Science.
Great, sweetie. But there's also things like fluorosis, which could be mild. Then there could be more severe, like skeletal fluorosis, and that's why, again, just coming back to fluoridated water, it's very closely regulated to, at that level, at levels that even with a safety buffer that we know are safe, right? And what's in our toothpaste and what's in our mouthwash and all that stuff. But can you talk just a little bit about what fluorosis is, just briefly?
Yeah, absolutely. So it's the way that the tooth mineralizes. So if there's too much fluoride, it can look either like a bright, chalky white or even turn into like a brown mottled yellow. Tends to be mostly an aesthetic issue that can be resolved with a restorative dentist, whatever it may be. But going back to your point, it really is the dose that makes the poison. We have recommendations for a reason. We have guidelines. We have dentists and doctors overseeing this. It's not like we're saying, hey, again, take this jar of fluoride and chug it. We know how much you're exposed to, and we'll recommend X amount based on that. And some people may not need it, and we're okay with that too. So I think understanding that it depends on the individual, and with everything, there are risks, benefits, alternatives, and that's science to a T.
Oh, beautifully
Absolutely.
said. Mic drop moment.
Yes. A great way to kind of end that conversation. And, we've been enjoying ending our episodes on a bit of a lighter note by asking all of our guests, what's something right now in public health, science, that is giving you hope and sort of helping you to sleep better at night?
So I'm biased from the oral health world, but I'm really excited that oral health is being taken more seriously in the overall systemic view. Specifically in 2026, there are a lot of maternal oral health initiatives, which we didn't even get into today, but correlations between maternal oral health and fetal outcomes being explored more. And I think the willingness to build us back into the body really excites me. That's what gets me going, which is so lame, but I'm excited about it, hopeful about it, and excited to keep moving it forward.
Ashley, where can folks follow you and the incredible work you're doing?
So for social media, you could follow me personally at Pediatric Dentist Mom, and you could follow First Grin along at First Grin on all social platforms.
Amazing. You're doing such incredible work. Thank you so much for joining us.
Thanks, Ashley.
Thank you for all you do. You guys are doing such important work and making all the data and science understandable and digestible, and that is such a beautiful and important thing, especially now.
You're gonna make Jess cry.
We love you.
All right. Thank you all for tuning in. We hope you learned a thing or two. I certainly did. Please join us next week on your trusted source for no nonsense, just science.